we are back. I am with Doctor, Minister, ARVs enthusiast, and Sangoma of the people. It's Dr. Motsoaledi. Hey, Dr. Motsoaledi, how are you?
I'm okay, and you, Chester?
I'm very well,
thanks for coming back. Good to see you, long time, eh?
Yeah, it has been a while. I haven't seen you for a few years now.
Yeah, I don't know why you're boycotting me.
I love you. I follow you to State of the Nation. I'm glad you still got a job within the movement. How's it going in the ANC? It seems like things are going bananas out there.
No, not yet.
What do you mean not yet? Have you seen Zondo?
Yes, I've seen it.
Do you know how much trans fats Nomvula Mokonyane is being given by Bosasa? She's got whole bright packs, Uncle. You need to look into her health for us.
Yeah, well, look, wait for the Zondo Commission to report.
That's true.
On their findings.
That's true. Listen, what is the solution to the inequality in our medical system? We're profoundly unequal. I mean, do you know that, you probably know this, that there are 400 state hospitals and 200 private hospitals that just serve 16% of our population. That is extreme. It's like apartheid ended, but apartheid stayed in the medical health care. No wonder it's called discovery. It's colonialism.
I'm happy, Chester, that you see that, because quite a number of people don't see it. That's why we want NHI and a body no less than the World Health Organization and the OECD, the Organization for Economic Development and Cooperation.
OECD?
Said it.
OECD,
yeah.
It sounds like you've got a control problem.
They said it very
OECD.
They said it very clear.
Yep.
In terms of healthcare, we are the most unequal society in the world.
Yes, we are.
If you want to see what inequality means, come to South Africa.
But Uncle.
Because, yes, we have got a situation where 4.5% of the gross domestic product of the country is available for the healthcare of 16% of the population only. And 4.2% is available for a whooping 84% of the population. Where have you seen that amount of inequality? It doesn't happen anywhere in the world. That's why,
Malumi, I don't understand something.
The World Health Organization even calls us an outlier.
You're right, we are, but why? Yes. Who's been running South Africa for the last 25 years? I don't think it was the Guptas, and well, some of it was, but who's been, you've been running it?
The Guptas were trying to run it, but we are pulling it back. Now, that's why we came up with the concept of NHI, which is called universal health coverage. It's an equalizer between the rich and the poor. It's going to demolish that type of system where there's such gross inequality.
But Malumi, you see, here's the problem. Here's what I don't understand. You NHI, that you want to solve all our problems, just give all our money to you and hope for the best. I mean, you're basically going to turn our healthcare system into the SAA, a big metal object that's going to kill people in the sky.
People always say so. They talk about ESCOM, they talk about SA. It's because we have produced a white paper.
Even the paper is white. Even the paper is white. This is what I'm talking about. Listen, man, if our healthcare is so good, why do Didi Mabuza and Uncle Jacob go to Russia for medical care?
Last week.
Have you asked Didi Mabuza about that?
Yes, I've spoken to him.
You did speak to him about it?
Yes.
What did he say?
Last week he went for checkup at Steve Biko Academic Hospital.
Really? Did he?
Yes.
Is he going to die soon because someone left a spatula in there or something?
I spoke to him. I arranged for him. He went to Steve Biko Academic Hospital. On Monday, he met me. He was very happy.
Really?
That's
amazing. Because I don't think I've ever seen Didi Mabuza happy.
No.
He's like Ace Makashule. He doesn't smile. You really need to go tell Ace.
You got Academic Hospital, many other ministers, because it's next to the seat of government. It's where we
are. In town. It's down at the drive anyway.
Many of you don't know this. Are you aware that these doctors who are coming out with innovations are working in our public hospital? Do you know that?
Yeah.
Dr. Chifularo.
Yeah.
Mashudu Chifularo.
Yeah.
Who did the first middle ear transplant
ever, what transplant?
Following 1967 heart transplant by Dr.
But Uncle, we had the first...
He's working, he's a full-time worker in Steve Biko Academic Hospital.
But Uncle, we had the first...
Then we have got the professor... We had the
first penis transplant.
He's working at King Edward at the hospital, and she came up with this gene that explains balding in black...
the what?
Yeah.
Oh, balding, I know, that's very black woman. I saw that, it's fantastic.
These are people working for the state, and they are doing research, and quite a number of people believe there's nothing happening there in the public health.
No, I don't believe that. I'm not one of those racists. I don't believe that. But I do want to know, we had the world's first penis transplant in South Africa. We had the world's first fetus transplant. And they put a white penis on a black guy. And quite frankly, I think as a revolution, we need to discuss that.
I don't know what is the importance of that, Chester.
But it happened. It happened. Was the penis's name Derek Hanekom? I don't know.
What about Derek Hanekom?
Well, the penis was a white penis.
Hey, what are you trying to say, Chester?
Nothing. I'm trying to ask you about facts, and you are just avoiding the point, and I'm finding it very confusing.
Okay, let's not talk about black and whites when you talk about physiology and anatomy. Is the
about
same
what?
thing. Physiology and anatomy.
Oh, you're saying white and black penises are the same, and we need to accept that?
It's just skin deep. It's
skin deep.
It's just a pigment, you know, melanin in your skin.
Melanin, Amandla. Unless you want land.
Unless you want land.
And yeah, but then it's skin deep, Matt. Never mind. Listen, how you're busy working on dealing with non-communicable diseases. That's where our big problem is. I mean, there are no, if you've got a heart problem in Limpopo, you're screwed. You have to come to Gauteng. How are you going to solve the inequality? That's what I really don't understand.
That's exactly why I mentioned NHI. If you go to Limpopo, let's say talk about Polokwane. There are 2 private hospitals.
Yeah.
Inside there are specialists who are highly trained.
2 of them.
But there are
only 2 of them.
I'm talking about the 2 private hospitals there.
But they're 2
now,
of them.
under NHI, I want to say if the public hospitals are full, you must be able to utilize the private hospital because these are facilities within our country. Fortunately, Limpopo is getting a new medical school.
Excellent.
The students are in their 3rd year. They are going to get the new academic hospital because it was not the only province where people have to refer to Gauteng.
Absolutely.
It was Limpopo,
other provinces, in fact, all the provinces.
Cape and Northwest.
All the provinces. As a puppet, what do you have any health suggestions? This is my last 20 seconds. Any suggestions for me as a puppet to keep healthy?
Well, if you keep healthy, don't smoke. Avoid excessive use of alcohol.
Uncle, I don't. I'm made out of latex.
If
I smoke, I'll burn.
Yeah, so don't even try.
It's like Didi Mabuza. Have you ever seen Didi Mabuza smoke?
Then on diet.
Have you ever seen Didi Mabuza smoke?
I smile with you.
You see, puppets don't smoke. I am Chester Missing. That was Dr. Motsolaedi. Good luck in the elections.
Thank you very much.
Give me a kiss.
Yes.
Give me a kiss.
You are going to vote ANC.
Okay, no, I want a kiss. I want the kiss of love. There.
Vote ANC, Chester.
Yeah, vote.
Why do you want to kiss me? Why don't you kiss ladies?
Oh, yeah. So vote first penis transplant. But thank you. Vote for somebody. Bye, Motsolaedi.
Thank you.
Oh, my God.